I trusted my doctor for 8 years until I discovered what he'd been hiding in my medical records. I always thought Dr. Myers was one of the good ones. Attentive, patient, actually seemed to listen when I described my symptoms. In a healthcare system where you're lucky to get 10 minutes with a doctor, he'd spend 30 with me, asking questions, taking notes. I recommended him to everyone. My health problems started small. Constant fatigue, joint pain, occasional dizziness. Dr. Myers ran tests, prescribed medications, adjusted dosages. Some helped temporarily, but nothing solved the underlying issue. These things take time, he'd reassure me. We'll figure it out. 3 years turned into 5, then 8. My symptoms gradually worsened. I started missing work, canceling plans with friends. Some days I could barely get out of bed, but I trusted Dr. Myers completely. He showed me test results that were borderline but not concerning. He said my symptoms were likely stress-related, maybe depression. I believed him. Last winter, I developed a rash that wouldn't go away. Dr. Myers was on vacation, so I saw his colleague, Dr. Patel. She reviewed my history, frowned, and ordered a different set of tests. Has anyone ever tested you for lupus? She asked. Dr. Myers did years ago, I said. It was negative. She looked confused. I don't see that test in your records. He definitely tested me, I insisted. He showed me the results himself. Dr. Patel hesitated. Would you mind if I request your complete medical records? Sometimes things get missed in the system. A week later, she called me personally. Her voice was different, careful, controlled. I'd like you to come in. There's something we need to discuss. In her office, Dr. Patel placed a thick folder in front of me. These are your complete records, she said quietly, including notes that don't appear in the electronic system. What I read made me physically sick. Dr. Myers had suspected lupus during my very first year of symptoms. The tests had come back positive, not borderline, but clearly positive. There were notes about referring me to a specialist, notes about starting immediate treatment, notes with question marks about why I hadn't followed up, but he had never told me any of this, never referred me, never prescribed the right medications. This can't be right, I whispered. He showed me test results. Dr. Patel looked pained. The test results in your electronic chart have been altered. The originals are here. She pointed to papers with different numbers, different results. Why would he do this? My hands were shaking. I don't know, she said honestly. But this isn't the first time. There's an ongoing investigation. It turns out Dr. Myers had a pattern with certain patients, mostly women with complex autoimmune diseases. He would diagnose them with anxiety or depression instead. Some insurance coding issue made this more profitable. Some patients eventually sought second opinions and got proper treatment. Others, like me, trusted him completely. 8 years of unnecessary suffering. 8 years of damage to my organs that can't be undone. 8 years of being told it was all in my head when there was a clear diagnosis sitting in my chart. The hospital's risk management team contacted me. They used phrases like settlement and confidentiality agreement. My new lawyers used terms like malpractice and criminal negligence. Last month, I finally saw Dr. Myers again, across a conference table, flanked by his attorneys. He wouldn't meet my eyes. I wanted him to explain, to apologize, to show some recognition of what he'd done. But his lawyer did all the talking, clinical and detached, as if my life hadn't been shattered. I'm on proper treatment now. Some days are better than others. The damage can't be reversed, but it can be managed. Dr. Patel says I should focus on moving forward, not looking back. But sometimes I lie awake wondering about his other patients, the ones who might still trust him completely, the ones who don't know what's hidden in their records. Now, when people ask for doctor recommendations, I don't just give names. I tell them to request their complete medical records, to ask questions, to get second opinions, to remember that blind trust can be the most dangerous prescription of all.